you for staying tuned again on my regular weekly Sunday 9 p.m. live video. Okay, I'm Dr. Tani Ping, a consultant obstetrician and gynecologist. And once again, we're going to talk about endometriosis. I hope you're not too bored with endometriosis. And because recently I have been attending a virtual conference in endometriosis that is done in US, organized by the Foundation of Endometriosis in America. And it was like full, nothing but endometriosis for the next 3 days for me. It's 72 hours long of endometriosis lectures. They do it in a very interesting way. They do it around 24 hours and over 3 channels. But yeah, we can rewatch. It's pre-recorded, so we get to watch over the next few days. So there's so much new info, and I have not watched even half of everything yet. So started yesterday, and I'm watching it again today. A lot of very interesting info on endometriosis as usual. And one of the reasons why I decided to attend this particular conference is because I rarely get to attend this conference because it's usually in US, and you know, when it comes to US, it's a bit inconvenient for us to travel so far, and that is the advantage of pandemic, because pandemic allows all conferences to be run online. And last year I sent my team to attend the chronic pelvic pain conference, which is also in US. And that was very interesting because we learned all other methods of support for endometriosis pain, mainly for pain relief, which is why I've started the support therapy for endometriosis, which is dietary therapy, pelvic floor therapy, as well as psychological therapy for endometriosis, and that seems to help in the majority of women. But at the same time, now this particular conference is a lot more medical, so it's targeted mainly on medical and surgical treatment rather than the complementary support treatment. So that completes the entire endometriosis care that we give, either surgically, medically, or complementary therapy, which all very complete conferences that I have been attending recently, and the topics are very interesting, and I'm very happy to attend it, and I hope I can help more women with endometriosis. Okay, a lot to learn. There's always new things. In the field of medicine. So that is why I always tell a lot of women, not all gynaes are the same, because every gynae has their own passion. And when a gynae passionate in certain things, that is the thing that they will learn more and make themselves up to date with that aspect. So there is no say this gynae is better, that gynae is better. No, every one of us just have a different passion. If my passion is on female cancer, so I'll just keep attending conferences and workshops and conferences and seminars and webinars, all related to cancer. So when you go and see that gynae on endometriosis, of course they are not the best endometriosis gynae, but they are definitely the best cancer gynae. So that's the only thing you need to know, that not all gynaes are the same. So some of us are more passionate in endometriosis and not everyone. So that is why there is a bit of difference as to who you see as a doctor, and that is why it also affects the treatment that you get. Alright, so back to this series of endometriosis. So today is our seventh, and as I said, it will end this month, so next week is number 8. And I realized there's still 2 very big important topics that we have not covered, and one of it is one of the questions today that I will be covering. We're going to talk about something related to endometriosis as well. So so this, for those of you who have missed the previous videos, please go to my YouTube channel. My link is in this video. Just click onto the link, go to my YouTube channel, look at the previous videos, and remember to subscribe to my YouTube channel, and also click onto the notification button. Alright, so let's see some of the questions that you all have posted up. Okay, Evelyn Ting asks, When remove Mirena, any side effects possible happen to body after many years of Mirena in the body? Okay. Mirena is something that I tend to advise a lot of women to put because that's one of the medical treatment for endometriosis. Partly it's because it is a progesterone. So all of you who have been listening to all my videos, you'll know that the key behind endometriosis is to, if you want to use medical treatment for endometriosis, the only one word you must know is progesterone. Because progesterone is the only medication that you can use long term and at the same time controls endometriosis. So any side effects to the body after you remove? No, definitely no, because it's actually going back to what you are originally. So taking out Mirena doesn't have any bad side effects, but I would question you is why you want to take out. Aren't you afraid of endometriosis coming back? Because I have this one lady that I still remember. She's on Mirena for a long time. Actually, this lady is very interesting is because she doesn't know she has endometriosis. She only know that she wanted to prevent pregnancy, and so the gynae asked her to put a Mirena, and then she put a Mirena. And then after 5 years of Mirena, she like, maybe I don't like Mirena, maybe I just put the normal IUCD without the progesterone one. So she go and change to the normal IUCD without progesterone. And then after about 6 months to 1 year, when she was using the normal IUCD and she started having pain during sex. Her complaint was pain during sex. So when she came and asked me, it's like, why is it I changed to this one, I had pain during sex? And she mentioned that actually she had this pain during sex even before her Mirena. But with Mirena, she's good. Then, now she changed to the normal IUD, she had pain during sex. So I told her, it is a very obvious answer. You most likely have endometriosis. You have endometriosis, but it's not seen on ultrasound scan. You see, again, I told you, normal ultrasound scans cannot see endometriosis. So she didn't get a deep endoscan. But anyway, this patient was my patient many years ago, and I don't do deep endoscan many years ago. Anyway, deep endoscan only invented just a few years ago in the world. Okay, so a few years back, I don't even do deep endoscan, so I don't see any endometriosis in her. So as a result, then I told her that, but based on your symptom, because of Mirena, you have no pain. Before that, you used to have pain. On Mirena, you have no pain. And now you put normal IUCD, you have pain again. So obviously, you have endometriosis. So what you need to do is just take out this normal IUCD and just put in a Mirena again. And that's what she did. And no pain already. So you see, the Mirena helped her. So obviously, if Mirena seems to help you, then definitely what you have is endometriosis, because the only thing Mirena can change is the endometriosis, the activity of endometriosis. Because Mirena suppresses the activity of endometriosis, so makes your endometriosis less active, and as a result, that's why they have no symptom or pain go away. So that is this case. For those of you who do not know what I mean by deep endoscan, go back to the very first video in this series. Yeah, this series today is already number 7. So go back to number 1. Okay. Alright, then the next question is Lee Yenzen. She asked that any risk or any information regarding pregnancy for endometriosis or adenomyosis. So I don't really understand the question. The question is any risk or specific info of pregnancy for endometriosis or adenomyosis patient to know more than normal or healthy women. So I think basically she wants to know the effects of endometriosis, adenomyosis in pregnancy compared to other women without endometriosis and without adenomyosis in pregnancy. So I think first of all, I need to let you know that only around 50% of women with endometriosis and adenomyosis can conceive. So for those who have conceived with endometriosis or adenomyosis, they are just very lucky. Okay, they are the lucky 50%. Okay, not the other 50%. So well, good. So a lot of women actually with endometriosis do get pregnant because it's 50%. So the incidence of endometriosis is so common, so much. We say 10 to 20% of women got endometriosis, and then half of them can get pregnant and half of them cannot get pregnant. So the half of them who get pregnant are very lucky. But is there any problem with endometriosis and adenomyosis if you are pregnant? So endometriosis and adenomyosis, few things. One is the pain. Some women do continue having pain during the entire 9 months of pregnancy. Because we know in endometriosis there is a lot of adhesions. That means things stick to each other. Things that stick to each other. Your bowel and your uterus may stick to each other, or your bowel or your ovary all stick to each other. And in pregnancy, your uterus gets bigger and bigger and bigger. It's going to pull on the area that is stuck to each other. So can you imagine, first is the bowel here and the uterus here. Originally, these two things are not supposed to stick to each other. The bowel is free to move, the uterus is free to move. So if the uterus gets bigger, it doesn't matter because the bowel is free to move. But now your bowel and your uterus stick to each other. So when your uterus grows bigger and bigger and bigger, it's going to pull onto the bowel. And as a result, there's a lot of pain. That's why a lot of women also notice that younger women that normally don't get pain when they get pregnant. You see, I see a lot of women when they get pregnant, they get this pain on the right side, on the left side, they all get all this type of pain. And then when they go and tell their mother say, no lah, when I'm pregnant, I never had all this pain. Well, I don't know what's wrong with you, you better ask your doctor. Then when you can't see gynae, you say, oh yeah, this pain is normal one. Actually, it's because a lot of women nowadays, they get married when they're a bit older, and as a result, they may have a bit of endometriosis, little bit of endometriosis, which you do not know. And as a result, when you get pregnant, when the uterus gets bigger, it pulls onto the endometriosis and you get a bit of pain. Your mother never had it because your mother was pregnant very much younger. So endometriosis is a problem today. More of a problem today in women today is because women are also getting older today when they got pregnant. Okay, so pain is one thing. The other thing is adenomyosis. For adenomyosis, there's a slightly higher risk of miscarriage, slightly higher risk of premature labor, and also slightly higher risk of cesarean section. Okay, we say the part of the uterus that is adenomyotic, which is the part of the uterus with adenomyosis, cannot function in labor. So it depends on how much of your uterus left that can function. If let's say your uterus 50% already have adenomyosis, then when you give birth, the 50% cannot function, then another 50% can function. So the function will be less, the power of the uterus will be less. So it depends on whether your baby is big or small. So I do notice that women with adenomyosis tend to have a slightly higher risk of cesarean section, even if we try very hard to have natural birth. Okay, because for those of you who know me, I am also a very pro natural birth doctor. So I really try very hard to let them have natural birth, but I still see a big number of them to end up with cesarean section. But of course, that's not a rule for everyone. We still have some women who have very easy birth with adenomyosis, but it's just a general rule. So you have slightly more cesarean section, you have slightly more premature labor, and also slightly more miscarriages. That's all. So but in many times the premature labor and the miscarriage is preventable by taking a lot of medication to prevent miscarriage and prevent premature labor. But the birth part, I think, is a bit difficult to help you, but you can always still try. You know, you may be the lucky one who can get natural birth even with adenomyosis, which I have seen people with early labors with easy birth as well. Alright, let me see. I want to talk about a slightly bigger topic that I think we should cover it. And this question comes from Harnisa. Harnisa Tajuddin texted me, I think last week. So the question, or 2 weeks back, Harnisa Tajuddin asked this question, Hi Dr. Tan, we observe retroverted uterus due to endometriosis stage 4, and I'm complaining the pain intensity increasing from waist to toe. Previous visit on October 2020, everything under control, and now on Visane since she was on Visane since November 2018, which really helps me to reduce the endo pain. Met a psychiatrist eventually. I am unable to bear the endo pain after menses. My question is, hysterectomy is the best option if the pain increasing and affected my life. Currently, there's also pain during intercourse. So you see, she has a lot of issues. She has pain from her waist downwards all the way to her toes, and she's also on Visane. It does help to reduce the pain, but probably she still had pain, and she still had pain in intercourse. Interesting thing is she actually met the psychiatrist eventually because she's unable to control her pain, which is actually one good thing, because as I say, you need to also do some psychological therapy as well. And in this latest conference, the latest info that I gather is that endometriosis actually cause anxiety and depression, because all along we know that endometriosis and anxiety depression is actually linked, but we do not know which comes first initially. But now we know that it is actually caused by endometriosis, because endometriosis, as I mentioned sometime, when it comes to fertility, I always say this: endometriosis releases a certain toxin, which is a chemical that's released by endometriosis that goes around your whole body, because it goes into your blood vessel and it goes around everywhere. And this is a toxin that is the reason why a lot of women with endometriosis cannot get pregnant, because the toxin kills the sperm, kills the ovary, kills the eggs that are supposed to come out, kills everything. You know, your embryo in your IVF, it just kills the healthy embryos as well because of this toxin effect. But apparently this toxin in the blood vessel goes up to the brain as well. It goes everywhere, and in the brain that causes certain changes to the neurons in the brain and resulted in anxiety and depression. So you see, that is why endometriosis need to be treated. Endometriosis is not just a disease of menstrual pain, so simple, yeah? So, okay, her good question is removing the uterus a solution? Is removing the uterus a solution? Okay, traditionally, that is the advice you get from a lot of doctors. What happens in the past is that, in the past, there are very little option, okay? Visane was not available at that time. Visane is a very new medication. It's only probably in this world 5 to 10 years ago. So in the past, there's no Visane. And we know every other drug has too much a side effect. You cannot take long term. Lucrin 6 months the most. Lucrin we take 6 months the most. Zoladex 6 months. Danazol also 6 months. Their side effects is so much that it cannot be taken long term. But endometriosis is a long term disease. So if you do not have a medication that can take long term, then you have no medication. Because we know that other medications like oral contraceptive pills is not actually effective, and in fact it is just temporary, because it has an estrogen component in it that actually worsens the endometriosis over time as well. So actually there's no other medication for endometriosis that is effective long ago. Things like Mirena and Implanon, the progesterone effect is so little that it is not effective enough for severe diseases. Only effective for mild diseases. So there's actually no medication. There's no medication long ago. We don't have Visane. Also, we only have surgery. And we also know that a lot of times, even if we do surgery, like now, most of the gynaes are not trained to do complex endometriosis surgery. So when they do surgery, they just remove the cyst, remove the adenomyosis, and then leave everything else behind. You have endometriosis of the urethra, the bowel, the bladder, the lungs, the diaphragm, the heart, the liver, and it's all left behind there. And as a result, a lot of women go through multiple surgery because a lot of disease is still left behind, and so the disease comes back very fast, and the pain comes back, and you need to do surgery again and again and again. Okay, so that is why traditionally, what we do with endometriosis women is very simple. Just leave it until the stage where you cannot stand. Just remove the uterus and the ovary. The key about removing the uterus is you must remove the ovaries. You must remove the ovaries. You cannot just remove the uterus without the ovary. Because when you remove the uterus without the ovary, then there is still ovary that will stimulate the endometriosis that are everywhere else. That is everywhere else. You see, you may miss the endometriosis in the bowel or the urethra or the everywhere else. I still remember I had this lady that I operated, I think, more than 10 years ago. I operated on her more than 10 years ago. That time, I'm not trained to do endometriosis surgery yet. So she was in so much pain, and she was very willing. And that time, as I said, there's no Visane either. So she was very willing to remove her uterus. So she removed her uterus, and yeah, I still remember she also removed her ovary, because all along we know that ovary is something you need to remove. So I removed her uterus and ovary. I removed. She's only like 37, 38 years old at that time. Very young to remove. So as a result, we know that if you have no more ovaries at such a young age, you also have a lot of other problems. So as a result, we also stopped her menses for a while, for a year, and I told her, okay, you're happy now, 1 year, no problem, but it's time you need hormones again, because without hormone you're going to age too fast. So I started her on hormone replacement therapy, and what happened? The endometriosis came back. She complained of pain. She has no more uterus, no more ovary, but she's still in pain. Why she's in pain? Because there's still endometriosis elsewhere that wasn't removed, because at that time I was not trained. So you see, when you remove uterus, but if you never removed ovary, and you never remove all the other endometriosis in other parts of your body, then you're still going to be in pain even after the surgery. But let's say if you remove your uterus plus the ovary, then of course your endometriosis will not be active anymore. But question is, are you going to continue like this? Are you going to be on hormone replacement therapy to prevent old age diseases? Or are you just going to let your body age? So both ways also no good. If let's say I take my hormones, but then it will stimulate again those endometriosis that are elsewhere, that is not in your uterus or ovary. It will be stimulated and your pain will come back. And your endometriosis may come back also. Let's say if you do not want to go on any hormone replacement therapy, then you're going to age faster. We know research that women without ovaries have a shorter lifespan. Why do they have a shorter lifespan? Because they age faster. Because all the old age disease comes in faster, so you die faster. That's it. So maybe you don't care. Maybe I die faster is fine. No point living so long. Okay, women nowadays live until 80 plus. Maybe if I die 70 plus or late 60s, it's also a good thing lah. Children already grow up and live so long. Yeah, maybe you say that, but it's not just that. It's the other sufferings that you have to go through due to aging. Okay, so we know that women, I always tell a lot of women, it's not matter how old you die. It's not matter how old you die. But you need to see, women today are not the same as women in the past. Women in the past, when they are in their 50s or 60s, or when they're in their 60s, let's put that at 60s. In their 60s, a lot of women are still very active. Some women are still working. Even if they are not working, they're very active. They're going on holidays, they go on a lot of short trips here and there with their other friends, They do a lot of things. Some of them are still very active in NGOs, in welfare organizations, active in the church, in the temple, in the mosque. A lot of people are still doing a lot of things in life. Their life is still very fulfilling. Even though they may not be working, but they're still very much involved in a lot of things. Not like women in the past, when they're in their 60s, they're okay. Then when it comes to 70s and 80s, a lot of women start to slow down. Why? Maybe their knee pain, their back ache, and because of that they can't do much anymore. They may be limping when they walk, and because of that they can't be so active anymore. But if you're going to menopause earlier, let's say women who menopause in their 50s only have a lot of problem walking and going around in their 70s. But if let's say you menopause in your 40s, then you're going to feel the same thing, all these problems with your pain and unable to walk, backache, knee pain, and all those pain in your 60s. So are you okay in your 60s? People in your 60s, you'll be seeing your other friends in their 60s still very active, can work. Their memory is still good because they can work. They can still work. They can still move around, no pain, nothing. And they can still go on holidays. They can be active in societies, in churches, in temples, in mosques, in social events, welfare work. But you can't. You have a lot of pain. As a result, you have to stay at home the whole day. So it's the quality of life that we're thinking. I still remember it all depends on where you are and who your doctor is, For me, I tend to be very conservative with ovaries. I always feel that you should keep the ovary for your old age because women need to have quality of life. I still remember there was this also an endometriosis workshop seminar. No, it's not. It's an endometriosis conference, Asia Endometriosis Conference, that was held just before the MCO, which is in 2019 in Bangkok. It was in Bangkok. It was Asia, so a lot of Asia doctors there. Asia doctors still a bit more conservative type of doctors, a lot of them. So then there was this speaker that we invite from Russia. So this Russian speaker will come and talk about why even in endometriosis we should still try to keep their ovaries. So we shouldn't do the old way, where you remove uterus and ovary and just let them age, let these women just age. We solve their problem with endometriosis, but we just let them age. And in Russia they don't do that. They actually keep their ovaries, which I totally agree. Then there was this old consultant. From India who stood up because he's one of the participants of the conference. So he stood up and he said, what's the point? The ladies are already in their 40s, they don't plan to have children. Why you want to keep the ovary? Just take it away. And then her endometriosis is solved. All her sufferings are solved. He cannot agree with this Russian consultant. So the Russian consultant again points out on the research, and he points out all the research on why. It's all about quality of life. So in my heart, I was like, some old time, someone is a male, Indian consultant, old guy from India, probably, quality of life for women is not important at all in his mind. But for me, as a woman, quality of life is very important. I have to think about my patient's quality of life because I have to think about what I want to be when I'm older. I still want quality of life. We are modern women, we are not women who just stay at home and cook and take care of children. That's it. We have life. So we need quality of life even when we are 70 and 80. So like even my mother now, she's in her mid-50s, mid-70s. My mother is in her mid-70s. Trust me, she has no problem. She has no pains, nothing. Because I told her the things that she needs to do so that in your 70s, you're still pain-free, so that you can have quality of life. I say you cannot, don't do this, don't do that, then you have no quality of life. You see, so we need to think about quality of life for all our women. So it's not just endometriosis as a disease. Yes, endometriosis is a terrible disease to have because it causes so much pain, and probably we need to solve their pain. Yes, we have to solve their pain, but we still need to think about what's going to happen to them when they are after they menopause, until they age, until they die, because by the time they're menopause, this disease is settled. The question is how we're going to settle the pain from now until the menopause. That's why the key is, as I mentioned, the complete endometriosis treatment that I mentioned again and again in all my videos. You need to do a complete surgery. So you need to do a complete surgery. You need to find endometriosis trained surgeons to do complete surgery. So don't leave diseases behind on your bowel and your rectum and everything. I mean, if let's say you do leave behind like 5% of the disease, but don't leave behind most of the disease. Like a lot of time when we see people, they just take the 2 cysts out of the ovary, left and right cysts take out, and then all the endometriosis there is still there. So you ask me, the disease is going to take out maybe 20-30% of the disease, but you leave behind 70% of the disease there. Of course, the disease will come back very fast, and of course the pain is still there after the surgery. So we need to think about that, and then we need to think about the medical treatment after that. We do not stop medical treatment. Because maybe even I think that I remove 100% of the disease, but some of the disease, some of the endometriosis cells may be already in your bloodstream. What about those that are going somewhere else after the surgery? So we still need to be on some form of medical treatment until you menopause. So that's another thing. And the complementary treatment, the dietary changes that you need to do, the pelvic floor therapy that you need to go through with the physiotherapist, and the anxiety, depression and stress management that you need to sort out with the psychologist or the psychological therapist. So these are the things you need to do. You need to have a complete endometriosis treatment. Complete. Yes. So I hope I answered this question. So her question, does she need to remove her uterus? My answer would be so simple. Are you removing your uterus only? Then the answer is no point. If you want to remove your uterus, you make sure you remove your uterus plus your ovary. And don't be on HRT. No, that's not right. If you want to remove your uterus, make sure you remove your uterus and also all the other endometriosis. Leave behind your ovary. Go on medical treatment until you menopause. And the complementary therapy that I mentioned, complementary support endometriosis therapy, which means that you still need to go for dietary changes, you still need to manage your stress, your emotions, and also you need to go for physiotherapy. So that is complete. You need to go for complete treatment. Ultimately, it's a complete treatment. So removing uterus and ovary, yes, that solves your problem, but you're going to age. You have to ask yourself whether that is something you can accept. Aging faster than everyone else, is that something you can accept? So yeah, that's the answer to a question. Next question is from Fatin Nasra Zulkifli. She asks, what is the sign of adenomyosis? How does it appear on ultrasound scan? Of course, it does appear on ultrasound scan. Adenomyosis is something that's quite easily detected on ultrasound scan. Is it something like upper uterus look thicker than lower uterus? Does it mean you have period pain every time? Okay, yes. When you have one part of your uterus thicker than the other, that could be a sign of adenomyosis. Period pain every time you have period. Not all adenomyosis have period pain. So there are certain features of adenomyosis that cause more pain than the rest. Not all adenomyosis have period pain. She said that I don't really have severe period pain, just some headache during period and tiredness. Tiredness can be a sign of endometriosis because endometriosis release certain toxin into your body. There are a few reasons why you create tiredness. Number one is it releases toxins into your bloodstream, so you are as good at having toxin all over your body, so you feel sick. Actually, endometriosis women actually feel sick during period. They actually feel sick. They need to rest more. They are feeling tired. These are signs of endometriosis. Okay, so that answers your question, Fatin. Yeah, and then Evelyn also asked one question. He says that Evelyn asks how to know whether Mirena is suitable for the body after insert Mirena. I have yet seen women who are not suitable for Mirena. Most of the time, it's like they don't like the Mirena rather than the body not suitable for Mirena. Okay, when you put the Mirena, we know there are certain side effects of Mirena. Number one, the period gets less and less. So a lot of women actually feels that my period get less and less, and they cannot accept the fact that the period is less. But to me, that is the advantage of Mirena. Because when your period is less, means that in Mirena, the progesterone effect on the uterus is it thins down the lining of the uterus. It thins down the lining of the uterus, that's why your period become less. It is the same effect. When Mirena you put in, it also thins down the lining of the uterus that is outside the uterus. That if you remember the definition, what is endometriosis? Endometriosis is the lining of the uterus that is no longer in the inner part of the uterus, now it's elsewhere. So it thins down the inner lining of the uterus. It also thins down the lining of the uterus everywhere else. And so if your period gets less, that is the advantage of Mirena on endometriosis. So but some women, they cannot accept it. Especially women who have been told all their life that Menses is good because it passes out toxin. It's like, I do not know why people have this type of logic that has been passed down traditionally, which is actually a myth. There's no such thing. We do not release toxins just because we are having Menses, and as a result, you need to release these toxins to be healthy. It is all nonsense. Because women who are breastfeeding continuously, not having menses, women are not supposed to have menses. They're supposed to be pregnant and pregnant, give birth, and breastfeeding, and pregnant and give birth and menstruating. Originally, women who are doing that are actually very healthy women. Okay, so no. So most of the time, I've not seen women who are not suitable to have Mirena, but rather they cannot accept the changes that happen with Mirena. It's not that it's not suitable for them, it's just that they cannot accept. And sometimes we try to convince them, but they still cannot accept. No choice lah, it's their choice, right? But if they are not endometriosis, it's fine. But if they are endometriosis, I always tell them, you have to learn to accept one thing. Menses is no good for you. You have to psycho yourself today that menses is no good for you. So I don't want menses. The less menses, the better. Endometriosis women should have this in their mind, that they don't want menses. Menses is no good. So a lot of women will say, isn't menses good? I heard that menses is actually good for our body. Women must have menses every month. That's normal. I said that's not normal. Menses every month is not normal. That is very abnormal. That is only modern women. Only modern women got menses every month. When God, if you believe in God, or Mother Nature, or nature, whatever you believe in, when they created a woman, they didn't create a woman to have menses every month. They created a woman which have menses every month that will get pregnant eventually and continue getting pregnant until they die. That was what women supposed to do. Pregnant 9 months, no period. Breastfeeding, no period. Period come back, pregnant. No period. Breastfeeding, no period. Period come back, pregnant. Pregnant, breastfeeding, no period. Pregnant come back, pregnant. That was what women were meant to do. That was the normal thing that women were supposed to function. A normal woman function is to get pregnant and breastfeed continuously, no menses. Women today are a whole lot of abnormal women having menses every month. That's why women today are suffering. We are suffering more. There are more endometriosis in women today. There are more fibroids in women today. There are more endometrial polyps in women today. There are more uterus cancer in women today. There are more ovarian cancer in women today. There are more breast cancer in women today. All because women are so abnormal because they're getting menses every month. So you need to understand this concept. Women are not supposed to have menses. Women are supposed to be pregnant. So if I have a medicine that doesn't give me menses, for example, if I'm going to be on a medicine like Lucrine stop menses 100%. If I take Lucrine for the rest of my life, I guarantee you one thing: no endometriosis, no fibroids, no uterus cancer, no ovarian cancer, no breast cancer. So, the logic about having menses passes out toxin makes you healthier doesn't make sense, right? It does not make sense because the women without menses are healthier. But we are not talking about menopause. When I talk about women not having menses, but I'm not talking about menopause. Menopause is aging. It has its whole lots of problems. We are talking about women who are pregnant and breastfeeding. They are not having menses, but they are not menopause. So when you don't have menses, like if you're on Mirena, no menses. You're on Visane, no menses. You're on Lucrine, no menses, but not Lucrine long term, because Lucrine makes you menopause. Actually makes you a healthier woman. You have less problem. So we need to accept that when you have no menses with any of this medication, it's good for you. Women have to change their concept of what's normal and what's not normal. Okay? So you're supposed to have menses, but you're supposed to get pregnant when you're young. Ideal age of pregnancy, 17, 18. Because women are, when you get your menses when you're 12 or 13 or 11 or 10, you're not actually fertile yet. Women tend to be only fertile, our body only become fertile only when we're about 16, 17. That's why traditionally, that's the age people get married. If you go back and dig back all the old traditions, That's the age people start to marry off their daughters, when they're 17, 18, because that is when they start to be fertile. Human civilization, they knew that right from the dawn of time. And you're supposed to be pregnant all the way until you menopause, or until you die. You either die of childbirth or you menopause. So that was the original function of a woman. So now women are very abnormal. Yeah. So don't be so possessive over you're so attached over your menses. I need to have menses every month lah. No, that's not normal. Normal women don't have menses every month. Normal women don't have menses every month. God or Mother Nature didn't make women with menses every month. They made women to conceive. So women today choose not to conceive, choose to be educated, choose to delay marriage, choose to limit the number of children. So when you do that, that is why women today have more breast cancer, more ovarian cancer, more uterus cancer, more endometriosis, more fibroids, more polyps, more cysts. It's our choice today. So if you want to know more, actually I have covered this whole topic about cancer prevention, female cancer prevention. It's there in my YouTube channel. Go and look and you will understand how does all this cancer come about. And you will understand once again, it's our choices in life that made us more susceptible to cancer today. So, but there are things that we can do, like putting a Mirena, for example, no menses. No menses, then no endometriosis, and no ovarian cancer, because I got no endometriosis. I don't need to worry about ovarian cancer. So these are the things that women can do to prevent cancer. Okay, so go and look at my cancer video. There's so many things that we could do to prevent cancer. So you go and look at it. Okay, Kai-yin asked last week. Actually, it's last week. Doctor, long-term breastfeeding will prevent or stop endometriosis coming back? No. Key behind not getting endometriosis is no period. So when you breastfeed, you have no period for a certain period of time. Breastfeeding women, they have no period maybe for 6 months, 1 year. For me, when I was pregnant, when I gave birth to my eldest son, I had no menses for 1 year. Then the menses came back. Then I had a pair of twins. My second pregnancy was a pair of twins. And then after the pair of twins, I have no menses for 2 years. So when you have no menses, of course you have no endometriosis. But after that, your menses come back. Even when you breastfeed, your menses will come back. So that's when nature expects you to get pregnant again. But maybe you don't want to get pregnant so fast. So when your period come back, endometriosis will come back. So the key behind those women, those of you who already know you have endometriosis, and then you already got pregnant, maybe on your own, or with IVF, or with surgery. After give birth, it's either you get pregnant immediately. After that, that means your plan is, okay, I'm going to let it be. If I'm going to conceive, I'm going to welcome the second child. So if your thoughts are that way, then you don't need to be on any treatment. Just let it be. Because that's what I did. I know I had endometriosis. I didn't know before that. I couldn't get pregnant. So one doctor told me to go and do a laparoscopy. And when I did a laparoscopy, I found out I got endometriosis. And then only I was on Leukrine. After Leukrine, about 3 to 6 months, I got pregnant. And then I gave birth to my first son. And after my first son, I told myself, I'm not going to prevent any pregnancy. So difficult just to pregnant one. Just let it be lah. If I'm going to pregnant again, I'll just pregnant again. And that's what I did. So that's why I didn't go on any medication after my first baby. 1 year no menses, so I know I'm free from endometriosis. But after that, my menses came back. And then very fast. In fact, when my menses came back very fast after that, I got pregnant again. So that's what I did. But after my second pregnancy, which was a pair of twins, wow, it was a bit a handful, and then I had 3 kids already. So I told myself, no, I'm going to stop. So that is when I put in a Mirena after my second pregnancy. 2 years no menses, so I'm fine. But somewhere along the way, after that, when the menses came back, I didn't, no, I was also a bit naughty. I didn't do a Mirena immediately, but guess what? My pain come back. The little pain came back. I quick go and put in my Mirena. Don't take my chances. And I've been on Mirena ever since then till today. My endometriosis never came back. My pain never came back. So, if you don't want to have baby in between your pregnancy or after your childbirth, do remember to put on something. Put in a Mirena, put in an implant on, or take a depot injection, or take oral progesterone, whatever that fits you. You want to take tablets? You want injections every 3 months? You want to put implant for 3 years? You want to put in Mirena for 5 years? Do whatever you want. It prevents pregnancy, at the same time, it prevents endometriosis. Choose one of them. But never go on oral contraceptive pills. Okay? Alright, so don't depend on breastfeeding. Breastfeeding is not 100% reliable in prevention of endometriosis. And then next question, Maria Asha asks, I'm on Mirena since July last year. It really helps to reduce my period pain, and sometimes I don't feel pain at all. But the problem is my period drags until 3 weeks and the blood is not that heavy and more like spotting. Is it normal? Maria asks. So some women with Mirena, they actually get this little bit of spotting. To some women, it's just a 1 month thing, 2 months thing. Some will last for 3 months, 6 months, some 1 year, and some even more. Those who actually drag on longer, like 6 months, 1 year, or even more, normally it's because there's still some disease in the uterus specifically. Maybe you have adenomyosis, maybe you have fibroids, maybe you have polyps, maybe you have adenomyosis. There is still some disease left behind in the uterus. That is why the bleeding drags on. There are few things that you can opt in these cases. Normally there are 2 options. You only have 2 options. One is accept it lor. Accept this bleeding lor. Hopefully it'll stop one day, don't know when. I always believe that eventually it'll all stop. But you have to accept it lah. If not, then the second option is to do surgery to solve the problem that's causing you the bleeding lor. Or of course you can have the third option, is to change to some other medication. But most other medications will be the same. Because if you're going to take pure progesterone for the control of endometriosis, most of the time it will be the same side effect. So the option is actually either to do a surgery to solve the problem of what is causing you the bleeding, or just live with this Mirena, this little bit of bleeding every day, and don't need to do surgery lah. Choose either one. Okay, either one. And in most cases, I'll ask them to just bear with it, because I think most women will agree that little bleeding is better than the severe pain. They rather live with the little bleeding than the horrible pain. And just hang on a bit longer. Eventually, all the bleeding will stop. Because with Mirena, eventually, most of us have no more menses. Eventually, there's no more menses. So eventually, the bleeding will stop. So just be patient and hang on. Next question is Olina, from Olina Lee, which is also last week. She posted up this question. What about Nokulot, doctor? Yeah, it is a good question. Nokulot, or in other words, no testosterone. No testosterone is a very long name. So in simple, everybody calls it Nokulot. Nokulot, it is a type of progesterone, definitely. So can it help endometriosis? Definitely, because it is a progesterone. But the only problem with Nokulot is it is a progesterone that cannot be taken long term. Can be taken short term, but not long term. And you need to take Nokulot every day. Nokulot has a very notorious effect, that is, if you take Nokulot for a certain period of time and then you stop, Nokulot actually causes a lot of menstrual pain. Even in people without menstrual pain, when they take Nokulot, they have menstrual pain. That is the effects of Nokulot. So if you take Nokulot long term, of course, it can control your endometriosis. But the moment you stop, you have to be prepared for the horrendous pain. And that is why you seldom see people using Nokulot for endometriosis. Seldom. Nokulot is a progesterone that is more commonly used for, what do you call that? Menstrual bleeding. Heavy menstrual bleeding. And as usual, it's usually only for short term. Okay, next question again from Yanzhen. Li Yanzhen asks, Doctor, as you always mention, endo patients need medicine until menopause. May I know endo or adenomyosis patient who already menopause got higher chance to get uterus cancer? And is there any way to prevent for patients to take good care? For endometriosis patients, after they menopause, the disease becomes not active. And as a result of that, their chances of cancer is actually very, very low already. Actually, most of our uterus cancer and ovarian cancer, the chances is very low after menopause one. Because the problem is very much hormone dependent, and when you have no hormone, most of the cancer, the risk is low. But of course, we can still get it in the early years of menopause lah, because let's say I have something, endometriosis, let's say I have endometriosis, and I haven't menopause, I got endometriosis, and some of the cells inside the endometriosis may have already mutated or changed and turned into something that on the way to be cancer. As I mentioned in my cancer videos as well, cancer don't turn overnight. They don't turn into cancer overnight. They turn into cancer slowly, progressively over the years. So if let's say it is already trying to turn to become cancer, or already turning into something that is pre-cancer, and then you menopause, but because the cells have already changed, eventually the cancer will still come on. So the cancer risk is still there in the early years. But as you grow older and older and older, all these kind of cancers, actually the risk is lower because it's hormone dependent. So not to worry, most of the time after menopause it should be quite okay. But if you ask me what are the things that you need to do to take care to prevent cancer, then my answer is also very simple. Avoid hormone therapy. Go back to my cancer prevention, I will tell about hormone therapy. A lot of women when they menopause, they always get menopause already, I will age. Menopause already, I will grow older. I scared I grow older. I scared I grow uglier. I scared my face don't look so young. I scared of old age disease. Women. So women tend to try and solve their problem. Every woman in this world, they like to keep young and beautiful one ma. So when they menopause, they know they are going to grow old and ugly. So no lah, not necessarily must be old and ugly. It can be old and beautiful. But anyway, and because they worry about aging and the effects of aging, a lot of women actually start to consume hormones without realizing. You will have some friends recommending you this supplement, that supplement, that help you to reduce aging, to keep young and healthy and beautiful, so-called. Usually they all got hormones one. So if you take hormones after menopause, even without knowing that you take hormones, and these are the things that always end up having increased risk of cancer. So that are the things that you need to take care. Especially if you have endometriosis, because if you take hormones after you already menopause and you have endometriosis, then of course the endometriosis will be activated back and your risk is still there. Okay, Xu Wei asks, hi Dr. Tan, I have Cushing disease. I'm trying third medicine for endometriosis. So she has Cushing disease and she also have endometriosis. Now she's taking Yas because previous medicine all not suitable for me. Is it because Cushing actually make my endometriosis hard to control while I'm on Yas? Sometimes okay, but sometimes my period stop after 1 month. We know that endometriosis has multiple reasons why endometriosis come or why endometriosis worsen. We know why some women the endometriosis is very much more advanced. Some women they have mild endometriosis all their life, and one of the factors that affect is our own body's immune system. our body immune system. So what I mean by body immune system is, you see, you have backflow of period blood, right? You have backflow of period blood. It is something that backflow and go to somewhere that's not supposed to be there. Your body is supposed to be able to clear it. Because trust me, we have seen so much. I have, in fact, sometimes I do show to some of my patients as well. I say, you see backflow of menstrual blood. You see these videos all got backflow of menstrual blood. But you see this video of backflow of menstrual blood. But why no endometriosis? But your backflow of menstrual blood got endometriosis because the body is able to clear off all those blood. Our body is supposed to be able to clear off all this menstrual blood. Then why is it that in some women they're unable to clear it off? So it is back to body immune system. So when you have Cushing's disease, basically your body's steroid is very high. And when your body's steroid is high, steroids is something that suppresses your immune system. You see, when you're stressed, just like women who are stressed, when you're stressed, your cortisol is very high. Cushing women, they are not stressed, also cortisol high, because Cushing is high cortisol disease. But women, when they're stressed, their cortisol is very high. And because their cortisol is very high, their stress and their cortisol is high, and that is why their immune system is bad. And because their immune system is bad, they cannot clear away all this period blood. And that is why all this period blood remain in their body and then form endometriosis. And then even if you have little endometriosis, you should have your immune system able to fight it. But cannot, because your cortisol is high. So your immune system is not there, so the endometriosis is bad. So yes, but then for Shui, I just want you to be careful if you really have endometriosis, because we know that Yas is not really the best medication for endometriosis. It's good in controlling pain, but if your endometriosis is truly there, Yas is of course a better endometriosis medication compared to all other contraceptive pills, but it's not the best medication for endometriosis because there is still estrogen component inside that will stimulate your endometriosis. So for me, I would think it's best you discuss with your doctor and raise the concerns about estrogen in your Yas, and maybe you should go on pure progesterone instead, okay? Alright, so yeah, that's all for today. Time's up. So there are some more questions that we will continue next week. And next week I have decided there is still one more topic that is very important. Today mainly I want to talk about removing your uterus. Is that a solution for endometriosis? And next week there is another big topic on endometriosis which I have not covered, and since it's going to be the last, so I'm going to cover it. So if you have any more questions on endometriosis, please post it up today, because next week will be the last of the series of endometriosis. For the moment, we take a break from endometriosis, yeah, because I think a lot of women out there still want to know a lot more things about women gynecological illnesses. So I'm going to take a short break on endometriosis, although that is my passion for the moment. That is something I really love, and I am striving very hard to improve myself further to make sure that I can help all women with endometriosis. So I'm going to continue after this with my endometriosis conference that I have been attending since yesterday until tomorrow. Yeah, I hope I have more info that I can get and I can share with you in the next week's video. So put in all your questions in the comment section, and I will see you again next week, same day, same time. Yeah, thank you and bye bye.